According to USAID Global Health Report, health indicators in Nigeria are some of the worst in Africa. The country has one of the fastest growing populations globally, with 5.5 live births per woman and a population growth rate of 3.2% annually. It is estimated to reach 440 million people by 2050. With this rapidly growing population and development challenges, the country, Nigeria, drags down the socio-economic indicators for the entire African continent. HIV globally accounts for 9% of the global HIV burden. Nigeria still has the highest burden of malaria globally, which remains the top cause of child illness and death. Tuberculosis, maternal and child health are some of the current public health challenges of concern that will be discussed today. On your favorite health TV talk show, The Physicians, we will be discussing the current public health challenges in Nigeria. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, your popular and, of course, your regular host of the program. And, of course, with me is my amazing, beautiful, and delectable.
My name is Dr. Martina Agberi. I don't mind Dr. Memuna. She's actually been on my tail. As a co-host, I try to cope with her. She's very recalcitrant, but then I love to have her always on this show.
You know what? We are never going to deep dive into whatever she said about me. She knows, because today is a very important day for us to talk on the current public health challenges in Nigeria. That is the topic we have to focus on.
That's the topic we have. But remember in your intro, you said, I remember saying that I love my country, Nigeria, and I'll continue to love my country, Nigeria, despite the odds that we're going through. I just heard from what you said that we're actually dragging the rest of Africa down.
That is it. And we are supposed to be the giant of Africa. Now we are dragging the whole continent.
Yes, and because of the
array of issues.
Yes.
From health to political to economical, everything. We are over 200 million humans in Africa. In Nigeria.
In 2050?
Things will be tough. This is 2024. And so we have serious current public health challenges.
But you know what? We're very resilient people.
That is what has...
We're very resilient. And when we decide to do something, we do it well.
But the truth is that, you know, when you look at, go back in time to Chinua Achebe's book, Things Fall Apart. He says that when the center can no longer hold, things will begin to fall apart. And resilience is something that even though we can already see people palpably, we are feeling the challenges that are happening. Because there are lots of current public health challenges. Not one, not two, not three, not four. There are lots.
You know what I believe in our country, Nigeria? Remember the time of Ebola, how we all came together to salvage this nation?
93 days.
It will still happen.
It will.
It will still happen.
But we need to be able to deal with these challenges.
So all we can do is we'll keep re-emphasizing and letting the public know.
I love the hope that we have on this show. And I'm hoping that just two of us can make the whole continent. But again, we have an amazing guest who is always passionate. And for us on this show, having her is
a privilege.
It's a privilege and a reminder that even though we're having all this array of challenges, if we come together collectively, we will do better. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business and will always be our business. With us in the studio today is no other person. If you've been following us on the physicians, it's a regular face. And not just a regular face, you always go home with something very meaningful to help demystify, to help, clarify any health challenge that comes your way. And she's no other person than the amazing, beautiful, cerebral, walking encyclopedia, Dr. ALERO Roberts. She is a public health physician, a consultant public health physician, of course. For us here, she's a professor of public health, University of Lagos. So, Prof, you're welcome.
Thank you very much.
You look beautiful.
Thank you so much.
Always smiling.
Yeah.
Always smiling.
Prof, today, I've been excited, but when it comes to this topic, I feel really demoralized because we're talking about current public health challenges in Nigeria. And I know that is you walk the talk when it comes to public health. So what are the main current public health challenges that we have?
In fact, when you gave me this topic and I started thinking about it and I began to write down, my list was growing and growing and growing.
Page 1, page 2,
page 10, page 12, and I said, okay, no, this has to be. So, but I divided them basically into two. We have the current public health challenges that are purely disease-based.
Okay.
Things like infectious diseases, the HIV/AIDS, the malaria, tuberculosis, cholera, other communicable diseases. Then we have what I call the social determinants of health. You remember that one?
Yeah.
Exactly.
Which is healthcare infrastructure, human resources for health, healthcare financing. And when you then look at the myriad of the socio-political climate that we are in, you realize that the current public health challenges cut across everything and everybody. Are we going to talk about maternal and child health? Are we going to talk about infant and young child feeding? Are we going to talk about adolescent health, reproductive, mental, physical, psychological? Are we going to talk about the men's health?
Exactly.
A very forgotten topic.
Yeah.
And yet a very major one. Are we going to talk about
that you just said it,
Yes,
exactly.
you haven't thought about it. Men's health.
We always talk about the women's health.
Yes, but we don't talk about enough about the men's health. So we have got to talk about the men's health.
True.
Then something that we never thought we would face in our country, health of the elderly.
I know people are growing older these days.
They are.
Yeah. It's no longer news that we are not going to die of the infectious diseases more. We are going to die of the non-communicable diseases.
So that now brings in the non-communicable diseases, of which we have things like hypertension, type 2 diabetes, we have cancers, a multitude of cancers, and then of course the mental health challenges, which you were clearly exhibiting before the program started.
Thank you.
The truth is that in Nigeria, you wake up, most times you are not happy. You have to intentionally create that happiness.
That is actually a non-conventional way of managing.
Yes, I agree with you. Then another one that is not often thought about, malnutrition. Now we are talking about the cost of food items and the cost of food items and
Well, looks like we're actually there.
We are right there.
Yeah.
We are right there. You mentioned something that food security.
Yeah.
You can have all the money in the world to buy. You are not going to put the naira and kobo on the plate and use
and eat it.
No.
Yeah, you're right.
So, the food is expensive. Is it available? Where are you going to buy it?
So this affordable, but you don't even have
yes.
You don't even
go to the market and you are seeing empty stalls and where is the lady that sells garri? She's gone to market, she has not yet returned. 4 o'clock in the afternoon, she has not returned. There's no garri to buy. So there are many public health challenges that we are facing because these have a ramification and an implication on our economic status, our economic well-being, our national development, everything.
So Dr. ALERO, as the one who is actually on the grassroots, you deal with these challenges, you know a lot of them. And in our current situation in Nigeria, maybe we should just take like 3, 4, which are the ones that you think we should actually focus more on?
Top 3.
Top 3.
Healthcare infrastructure, human resources for health, healthcare financing.
Okay, so let's go.
So, because that then encapsulates everything that we are talking about. If you have and of course, me, primary healthcare physician, I would always start from the bottom and grow it up organically. So when a person first departs from the path of health, you have a headache, mild headache, and you don't know, or you can access healthcare at that point that it will probably cost you nothing to be put back on the road to health in a timely fashion. You can go back to doing your income generating work. Okay? But let's say for some reason this headache or this primary departure from health is not quickly dealt with. It's a symptom of a much deeper ongoing problem. You now do not access healthcare, either because, number one, it is not there. Availability. Number two, you don't have the money to get there and access it. Accessibility and affordability. It is a type of healthcare that's not acceptable to you. Acceptability. The truth of the matter is that you don't go in time. And I've got, I am replete with stories. And the one that comes to mind every single time, when my husband was called out one night, my darling husband, a neurologist of international repute. And he was called out, and he was at a time, he says, "Madam, please come with me." He doesn't want to be driving in the night alone. We got to the hospital. Young man, do you know who had brought him to hospital? His mother.
Wow.
In his early 40s. He suffered a stroke.
Wow.
A catastrophic stroke. Not yet married.
He's
in his 40s, not married. And the mother was, he has never been sick a day in his life. And you know what my husband said, that stories that touched me heart? I wish he had been sick, or he had broken he had injured himself playing football and had gone to hospital, and somebody had done his blood pressure. And he would have known. So that's why I'm mentioning those two things: men's health, mental health, malnutrition, the 3 M's. So if you had a health infrastructure, because if it was something that, for instance, where he's going to work, they said, go and do your birthday checkup. HR says, go and do your birthday checkup. And he was certain that when he went to the health facility and did his birthday checkup, they will not communicate to his workplace any information except he gives them permission. I promise you.
Okay.
So
now you've talked about that.
Infrastructure.
Infrastructure. So we're dealing with the current challenges. How is our infrastructure, the current health infrastructure in our country? What is the state at the moment?
I love that Dr. Memuna is already laughing. So you understand. You understand. 700, and we've had this story over and over and over and over again. 774 local government areas, comprehensive primary health care facility in each.
Which we have primary health care facilities about 30,000 plus nationwide.
But
how many of them are functional?
Almost 60% of them are not in a good state, in a deplorable state. Now, when we say deplorable state, we're not just saying weeds growing and windows not closing and things like that. No staff, no materials, no equipment. How do I do your blood pressure? Is it by looking in your eyes and smiling at you?
It's not miracle, it's not just.
I need a working sphygmomanometer. How do I take your temperature? It's not by putting my hand to your neck. So we need these, and that's the holistic view I have of the health infrastructure. It's not just the building. Because even when they announced that they are going to build and renovate another, what was it that they said the other day, and I said, where are the staff coming? Because if we understood from the get-go what the implications of this are, then, it's a question we should not be asking. Why is the health of the common man in Nigeria of such little importance to the powers that be? Why does it not matter that a woman cannot get good, skilled attendance at the time of delivery? Why does it not matter that a child will be sick, ill, fever in the night, and the parents cannot get that child to a competent, trained health professional in a well-equipped, well-lit health facility anywhere they are living in the country? They don't have to be living in Victoria Island or Banana Island. Why does it not matter to the powers that be? Because if it mattered to the powers that be, we would not be asking that question as to why we are not deploying, actually it's 5% of the budget into health.
Dr. ALERO, is it possible to, I want to say, assume that it is because we are not holding them accountable?
I don't think it's an assumption. I think it's a statement of fact.
Because if really we are holding them accountable, they will begin to do things the way it should be done. But we're just accepting it, and we are now a government of our own.
I saw a recent budget of 2024, Dr. Martin, I'm not even stopping you there. And when it came to health, in this particular state, the government house budget was more than what the government of this state budgeted for health.
It's not
and I'm like looking at it, how such a disproportionate.
Dr. Mamman, you are saying this because you were privy to having that information. How many people actually have such information? And even if they have that information, what can they do?
Yes, and this is where you say holding them accountable.
Yes.
How do they hold them accountable?
Dr. ALERO, maybe you need to school the public on how they should act and demand that this is what we need to be that needs to be done.
Okay, so let me ask a question. How important is your health to you? How important is my health to me? Yes. So am I the kind of person that says, oh, God forbid, hypertension is not my portion, or God forbid, diabetes is not my portion? If I'm that kind of person, I will never hold government accountable. I would rather go and pour my money into the churches so that they will bring prayer cloth and prayer water and prayer candle and knock me prayer for head to avoid
your head
all
is
those.
premium or nothing.
That is it.
That's it.
That is the truth. Because when you are sick, how much is money? Money is nothing.
We saw that in COVID.
Absolutely.
It's absolutely nothing.
Absolutely nothing.
We saw that in COVID. Do you remember?
Absolutely.
We saw that in COVID.
Because you got a stage in COVID, people had money, the medical
And they just could not.
the money didn't save them.
We could not even buy cotton wool.
Somebody even called me and said, Dr. Agbere, any amount we're ready to pay, just give us this drug. So it's not available.
It's not available. It's not available. And this is the situation we are seeing now. But there are whole load tranches of drugs that are not
it gets to a stage. It gets to a stage in life when you keep demanding or asking for something.
It's
and you're not
exhausting.
getting it.
Yes.
It gets exhausting. Exactly. You just let it go. Don't you think that is where we have gotten to?
Unfortunately, I'm beginning to see a lot of that sentiment among my colleagues. And this is not just the physicians, the dentists, the surgeons, the nurses, the entire health ecosystem. This sense of, well, what will be, will be.
And that's a terrible feeling.
It's a very terrible feeling. Because it gets to a point where, you see a patient in the accident and emergency, and the triage, the nurse on triage now gives the family a shopping list, turns her back, and walks away. This shopping list that the patient is going to buy, every single thing is necessary to save that patient's life. The cost is more than the family's monthly feeding bill. Where do they get that money from? At odd hours of the day. You understand what I'm saying? So holding the powers that be accountable, and all of us recognizing that we are partners and stakeholders in the health infrastructure is key. Because if you have a situation where we're talking safe water supply, we have a role to play.
Yeah. Refuse
and sanitation disposal.
We have
a role to play.
Dr. ALERO, that actually gives me the creeps. You know what is happening now?
Oh, I do know.
On the roads, you don't even have a proper place you can actually, people can dispose.
Yeah.
But what I would think about is the human beings, the people that bring that trash from their houses
and dump
on the road.
In the middle of the road.
And so when we talk about holding
power account,
it starts with us.
It starts with us.
Absolutely.
Because if we are doing anyhow, we are definitely going to, the result to be, you will see the result, which is glaring.
Yes.
And at the beginning we talked about the fact that Nigeria is dragging the whole continent down. So Dr. ALERO, we want you to talk about that. Let's emphasize, let's amplify that statement to our public. Like, how is Nigeria actually dragging the whole African continent down with our current public health challenges?
Because our mortality indices are too high. We have the highest maternal mortality rate of the continent. The highest under 5 mortality, the highest neonatal, newborn mortality, and these are the highest on the continent. And these are all deaths that are largely preventable.
Probably based on our population?
Is it really? It's based on population, it's based on culture, it's based on political commitment, because a lot of the things that need to be done don't actually require dollar per se. Like you said,
basics.
The cost of the dollar does not prevent you disposing of your refuse properly.
Yes, truly.
It's not because of cost of dollar that you brought it out from your house and dumped it on the road.
So just imagine, imagine a very clean place along the road. You leave your house with your trash on mindset. And you just go there and you put it and you leave.
And you're happy. And you think it's not going to, it's
neonatal death, we are the highest. Infant mortality, we are the highest. Maternal
mortality, we are the highest.
You don't even realize the health implication of dropping those things there.
No. And how it affects all of us.
Yeah.
Wow. And I think this is where we want you at this point in time to drop those hints, like tips that our, not only the audience, the government and all tiers of government, from the local to the state to the federal level, and to that Nigerian, that citizen listening to us now, what we need to do. Because these are statistics that are not hidden. They are anywhere, Google it. We are topping the chart and we are dragging the whole African continent down. So what should we do?
It's very difficult in the next 5 minutes to give a civic, a civic lecture that is a course for 6 years in primary school on citizen behavior. It's almost impossible, because this thing starts from the home. Now, if the home is not even in a state to deliver some of these culturation attitudes and behaviors, then what do? Who taught you to clean your teeth? Did you come out of your mother's womb knowing how to clean your teeth? Right. Somebody taught you to clean your teeth, taught you how to take a bath, taught you how to cover yourself in a decent and acceptable manner. Somebody taught you.
Why they do not depart from the...
And when you, and you learnt it so early in life that the thought of doing anything different, I mean, goodness me, it doesn't even occur to you. So it has to start with basic primary education. It must start with basic primary education. It must allow girls to remain in school for a lot longer. Girls have to remain in school at least till the end of secondary. And when I say school, school where there are teachers, trained teachers, not the ones you were describing one day on a past program where you had the whole primary school with only two teachers.
Mr. ALERO, talking about infrastructure before we round up, I'm just thinking out, because we already talked about even the people that are available. If I take it to the community, the primary healthcare centers within the community, is there something, do you think there's something something can be done to encourage the community people? Community engagement, so that if you can have the girls, the boys that grow up in that community, try out, even to get the basics.
I totally agree with you. These were the plans. When these the plans we were taught in medical school. Have you forgotten?
Yeah, right.
When these the plans we were taught, the village health workers, the community health officer, the community health
officer. How can we involve them now?
We have to strengthen because we are not bringing a new policy. We're simply going back into the system and dusting off those policies that have been tucked in shelves and saying, right, given the plethora of technological advance that we have today, how do we better implement these strategies to get to where we are going? It's not rocket science, I promise you.
See, I think we have to come back to deep dive into this community engagement, health system strengthening, and just let Nigerians know what you can do in your own little corner.
And it's something that we have to go literally village to village, community to community, society to society, because one size cannot fit all.
One size can't fit all. Thank you very much, Prof. And to our viewers out there, I took a deep sigh because it's really, really sad. If Nigeria, in the whole of African continent, we are the ones dragging the other countries down is very sad, because we have the highest neonatal death, the highest, maternal death, the highest infant death. Yes, we may be talking about our population, over 200 million humans, but again, it's way beyond that. Our political will, engagement, economic, even our cultural views, all these come into play in ensuring that we get it right. The current public health challenges are enormous, and Dr. ALERO has talked to us 3 major issues that we need to look into. The health infrastructure. The primary healthcare centers are there, over 30,000 nationwide in 774 local government. But how are they doing? Are they, the human beings, are they there? The structures are, what do we do? And of course, the human resources and healthcare financing. If you have a state that believes that the budget of the government house should be more than the budget for the health, for the health in the state, then that means we are on a long term. My name remains Dr. Memuna Kadri. Until next time, remain blessed.
Thank you so much, Dr. ALERO Roberts, for always honoring our invitation and always making us feel, I don't want to say excited or a bit downcast after your program, because you just have a way of bringing it down to the basics and letting us know the truth. We don't have a choice. We must go with the truth, because that is exactly what will always set us free. We really appreciate you for coming on our program. And to our viewers out there, I just want to say thank you for keeping a date with us on your regular Health TV talk show, The Physicians. I want to ask one question before I leave. In what way have you impacted your community? Positively or negatively? Think about it. The word is enough for the wise. My name remains Dr. Martina Admire. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.